Do you have a frozen shoulder that just won't loosen up? If physical therapy and traditional treatments have not worked, there's another option: platelet lysate hydrodissection. But when should you consider it? Let's break it down. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Frozen shoulder or adhesive capsulitis is a frustrating issue. It limits movement, causes significant pain, and can take months or even years to fully recover. Many patients struggle to find a treatment that actually works. That's where platelet lysate comes in. Today we'll discuss what frozen shoulder is, why it happens, why some treatments fail to provide relief, and how platelet lysate hydrodissection treatment works. When it's right option for you, let's dive in. So what is frozen shoulder? Frozen shoulder is a condition where the shoulder joint capsule becomes inflamed, thickened, and tight, restricting movement. It usually progresses in 3 stages. There's first a freezing stage where you have increasing pain and stiffness. Then there's a frozen stage where you have severe loss of mobility, but pain may actually improve. And then there's a thawing stage where there's a gradual return of motion over time. It can develop after an injury, surgery, or prolonged immobility. People with diabetes or thyroid issues are at higher risk as well. Most treatments for frozen shoulder focus on pain relief, but don't address the underlying problem: scar tissue, adhesions, and inflammation in the joint capsule. Physical therapy is essential and helpful, but can be painful and slow. Steroid injections reduce inflammation, but can weaken tissues over time if done too often. Surgery, in particular capsular release surgery, is invasive and has risks like infection or nerve damage. Manipulation under anesthesia involves putting you under sedation, then moving your shoulder around to break apart the adhesions. You have to be careful with that treatment because it has the potential to injure the rotator cuff as well. So when these approaches either do not provide relief or you want to avoid surgery, a treatment like platelet lysate offers a minimally invasive alternative. Platelet lysate hydrodissection is a regenerative medicine technique that utilizes a highly concentrated form of platelets derived from your own blood. It breaks up adhesions and reduces inflammation in the shoulder joint. Here's how it works. Step 1 is we take a sample of your blood, drawn from you, processed to extract the platelets to first create platelet-rich plasma. We then crack open the platelets and then save the growth factors. That's what's called platelet lysate. We utilize platelet lysate rather than platelet-rich plasma here because platelet-rich plasma is more inflammatory and platelet lysate is less inflammatory. Platelet lysate can actually reduce inflammation. Then under image guidance, usually ultrasound guidance, the platelet lysate is precisely injected into the tight, restricted areas of the shoulder, in particular into the shoulder joint and around part of the rotator cuff. Step 3, the fluid gently separates the scar tissue, reducing stiffness and allowing for improved movement over time. Unlike steroid injections, platelet lysate does not damage the tissue. It actually promotes healing. So when should you consider platelet lysate as a treatment modality? This treatment is a great option if you have persistent stiffness and pain despite physical therapy, steroid injections have not provided lasting relief in frozen shoulder, or if you want to avoid them, and if you want to utilize a non-surgical approach that promotes healing instead of just masking pain, and if you're looking for a treatment with minimal downtime. What should you expect after treatment? You'll have mild soreness for a day or two, and then gradual improvement in mobility over weeks to months. You'll have faster progress when combined with physical therapy. Most patients will see noticeable improvement within a few weeks of treatment with continued progress over time. In some cases, a repeat treatment may be needed a couple months after the first treatment in order to accelerate your progress. The typical treatment progress if you have frozen shoulder is 6 to 24 months with physical therapy alone. It takes time. So if you started physical therapy and after 1 to 2 months you are not progressing appropriately, that's when I would recommend utilizing platelet lysate treatment. This will help to accelerate your recovery and reduce the time to get back to your full range of motion. Frozen shoulder can be an incredibly frustrating issue, but you don't have to live with pain and stiffness forever. Platelet Lysate Hydrodissection is a safe, effective, and non-surgical treatment option that can help to restore mobility when other treatments fall short. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you're struggling with frozen shoulder and want to explore Platelet Lysate as a treatment, schedule a consultation with us today. See you next time, and until we connect again, live well.